Welcome to the dermatology clinic. My name is Leanna and I will be the provider doing your skin assessment today. How are you? Good. Yes, it's very nice to meet you. It looks like we have you on the schedule for a skin assessment of the face. They had made note that you noticed a new spot there. Oh, okay. So it's on your left side here, my right. All right. And how long have you noticed it for? Is it something that just sort of came all of a sudden, or it's been growing with time? Okay. Gotcha. And have you ever had something like this happen to you before? No. Okay. Now, have you noticed any changes at all as far as the size, the color, the shape? No. Now, is it associated with any other symptoms, whether it be itchiness? How about tenderness? Does it hurt you at all or cause you any pain? Okay. Does it ever bleed or do you ever see discharge coming out of it? Okay. Now, have you noticed any other physical symptoms going on with your body, whether it's fever, exhaustion, migraines? Okay, and what about swelling, uncontrollable weight loss? Okay. And have you tried anything over the counter to help treat that? Gotcha. I take it didn't do anything. No, I don't blame you at all. We sort of always try to fix our own problems, you know. No, that's totally okay. I just appreciate you being honest. What was that second thing you said? Okay. Alright, and since this is my first time meeting you, do you have any medical conditions that I should be aware of? Okay. As a child too, or? How about any family history, specifically of dermatological conditions, psoriasis, eczema, allergies? Okay. Mom or dad's side? Do you have any siblings at all? Okay. Anyone with a history of skin cancer, specifically in your family? Okay. Now, what do you do for work? Very cool. Nice. You don't by any chance have any environmental exposure to chemicals or mold or anything? And any recent travel at all? Okay. Any new antibiotics, prescription medications that you've been taking? Alright. And do you smoke at all, whether it be marijuana, vape, hookah, cigarettes? Okay. And do you drink alcohol? And how often would you say? Gotcha. And lastly, as far as history taking, do you have any allergies, environmental allergies, medication allergies, anything known? Okay. Is this your first time to a dermatologist? I think I'm done with my questions. Thank you for your patience. We are definitely going to take a good look at that lesion there, and we'll get it taken care of for you. It's honestly so good you came in. The second you notice any skin changes, whether it be with moles or lesions like this, it's always best just to get evaluated by a professional. Exactly. All right. Well, let me put some sanitizer on here. Of course, if you have any questions at all during this exam, please let me know. But I'm going to kind of walk you through what I think, and if we have to take any samples or biopsies, of course, I need your consent and I would let you know. Exactly. All right, so I'm just going to start by putting some gloves on. We are just going to start with a general inspection of your face. This is going to include the scalp area, the whole face, and the neck and lymph nodes. We will, of course, be focusing in on that area of concern, but we do want to kind of make note of what your normal skin texture is like. Do you have any products on your face right now? All right, that is no problem, because we're just going to kind of cleanse the face before we get started. All right. You're just gonna feel my gloves and this cloth here. Is that okay? Awesome. Just kind of cleaning off the surface here. Does that feel okay? Focus on that area. Just going to put a little bit more. Your skin is beautiful, by the way. My pleasure. Perfect. So, what I'm going to do next is just a general inspection here with my light. You can close your eyes for me. You just gonna take a quick look at your scalp, okay? next part here is I just want to do some facial sensations. You're going to keep your eyes closed for me. And you're just going to let me know when you feel a little poke. Eyes closed. Good. 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 Awesome. Mm-hmm. Good. 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 Very good. Did you feel all of those pokes equally on both sides? One side wasn't stronger than the other. Awesome. The next part here is I just want to feel the top of your head. Make sure I don't feel anything swollen, as well as you're going to feel my hands just around your lymph nodes. Perfect. Alright, no masses fell, just your lymph nodes here. No pain or tenderness. Okay. What about behind the ears? No. Here. Okay. Submandibular. Alright, very good. So overall face and scalp inspection was very good. So now we're kind of going to focus in on that lesion there. And honestly, based off of the way it was looking during the examination with the light, I think the best thing for us would be to collect a swab just to screen for bacteria or viruses. But it may be a good idea for us today to do like a shave biopsy just to send the pathology out to the lab so that we know the exact source and condition. Would that be okay with you? I know it's a lot to take in, especially when you may have not been expecting it, but I think this would be in your best interest. Very good. Okay. I'm going to walk you through the whole thing here. The first thing is I'm going to do a swab before I wipe down the area to get ready for the procedure. So let me grab this here. Okay. And so you're just going to feel this little swab here. I'm just going to collect a sample, but nothing sharp. Okay. You're not feeling pain, right? Okay. All right. Very good. Swab was super quick and easy. We'll send this out to the lab as far as getting like a bacterial and viral culture. Okay. This next part here is I'm going to measure that lesion and just kind of mark where we're going to be doing the shave biopsy. Awesome. And this is just a marker, should not hurt you at all. Very good. Alrighty. I'm just going to take an alcohol swab to clean the site before we take the biopsy. Like I said, just an alcohol swab. Who would have thought this would be the hardest part? That's not burning you, right? Good. Alright, alcohol swab is done, okay? You are making it through. Alright. For this procedure, I just have to wear eyeglass wear. So I'm just gonna put those on here. You ready? It's looking a bit scarier now. I assure you it's gonna go by a lot faster than you think. Okay. So, of course, the first part, any procedures, we have our tools here. No, not meant to scare you, but we're gonna numb you up so you don't feel anything. Yes. So, we have the numbing medicine here. I'm just gonna put this on the counter. Alright. Just gotta make sure this is working. Alright, you ready? Alright, we're gonna numb the site. Doing okay? Good, good, good. Alright, you're all done there. Get this cap on. Let's put this away. Alright, so for this next part here, I'm just going to be taking a scalpel. And you should feel pressure but no pain. Yes. Alright. Got some forceps. I got a specimen container to put it in. Alright. Gonna feel just pressure. But let me know if you feel anything other than pressure, okay? Good. Alright, good job. Okay. Alright, the shave biopsy part is done. Yes, yes, I told you it'd go by pretty quickly. I'm just gonna kind of take an instrument to scoop off any of the remaining skin that was shaven. Very good. Alright. You had very minimal bleeding. Barely anything, but I'm gonna put an ointment on there to stop it for you. This little bit goes a long way. You feeling okay? You did really good. Put a little bit more. You're gonna heal up very nicely. I'm gonna pack this for you to go. Just gonna put a gauze here. Just gonna keep some pressure on it there, just to stop the bleeding. Have any plans after this? Maybe an apple orchard? Yeah, I've been wanting to go to one for a while. And for every weekend I say, next week, next week. You know what it is, probably the colder temperatures right now. It's not appealing for me to leave my house. Alright. Bleeding is well controlled. Just put this band-aid. Alright, very good. Alright. Your examination today is completed. Yes, yep. So to reiterate, we did a full skin assessment for you. We did the biopsy for you to make sure the pathology is normal and benign, and it will give us a lot more clarification and answers as far as what's going on. Yes, it is so good that you came. It was very nice meeting you. I'm going to pack that prescription cream for you and you can take it home. But I hope you have an amazing weekend. And of course, if you have any questions or concerns, please let me know. If you notice anything going on with that site, again, let me know. But, it was very nice to meet you today. And I will be giving you a call once the pathology is back. Absolutely my pleasure. You have a good one.